As we age, our bodies have a decreased ability to heal injuries. And therefore, we need to harness our body's own cells to help push those injuries towards healing. I'm Dr. Ken Mautner, and I help a lot of professional athletes recover from their injuries. But we all do things that are athletic, and certainly we can all get the same kind of injuries that elite athletes get. And we're going to talk about how we can use our own body stem cells to help repair and rehabilitate damaged tissue. Now, I know what you're thinking, stem cells. What we hear about them a lot of times in the news is controversial, but I'm here to tell you this is a lot more simple than you might think. What we realize now is that stem cells are very powerful signaling cells, and when they are injected into an area of damage in the body, they will signal your body's own cells to come to the area, and that can create a very powerful and prolonged healing response. There are two main ways that we get cells from the body. One is from bone marrow. When people come in for a bone marrow aspiration, we numb the back of their hip up very well. Once we numb that area, we take an instrument and we go into their bone marrow and we extract out the cells from multiple locations. Once we get these cells out, we then place them in the centrifuge machine and we get rid of the products that we don't need. We are left with a concentrated form of the bone marrow, which is where the cells live. Then our job is to inject them into the area of the body where the patient's pain is, whether it's a joint or a tendon. Often, we use ultrasound guidance to assure accurate placement of the medicine. We also have an abundant amount of stem cells inside our fat tissue. We will take out a little bit of your fat through a mini liposuction procedure. Once we do that, we'll wash the fat, we actually put it through a purifier, we cleanse it, and then we inject your cells still sitting inside of your fat. What this does is create a scaffold effect where the cells will reside within the fat. So when we inject the fat graft into a part of the body, it is able to fill in the defect in the damaged tissue and enhance the healing response. Many aging athletes deal with arthritis. This is when the cartilage in your joints have worn down because of previous injuries or overuse. Although we don't have the fountain of youth for our cartilage and we don't have a way to completely reverse the process, stem cells have a very powerful and healthy effect on cartilage. They can not only prevent further breakdown of cartilage inside of your joint, but they also have very powerful effects on pain and reduction of inflammation for swollen, painful areas. These procedures are extremely safe, and we've been doing them for a number of years. Patients have had very few complications from the harvesting or injecting of cells, either in the short or long term. The risks of this procedure are much less than associated with orthopedic surgery. The amount of pain that people experience can vary greatly depending on the area of the body that we treat. Sometimes it is only mildly uncomfortable, other times there can be more significant pain during the procedure as well as in the following days afterwards. In general, there is a short period of rest that we require after the procedure, but then we want to get you moving and into rehabilitation. This means that you will have a quicker recovery than if you had had surgery. Sometimes people will start to notice improvements around 3 to 4 weeks after the procedure, but it's not uncommon to take 2 or 3 months until there are significant benefits noted. We are taking injuries that used to require going to an operating room, and we are treating them in our office with minimally invasive techniques using our body's own cells to help the recovery. This is really going to be the future of sports medicine.